Before I started medical school, I actually spent 2 years doing investment banking in New York. While I realized I didn't want to go into finance, one of the things I really appreciated was kind of how they function, how they solve problems. I started medical school here at Dartmouth, and what I thought about as I was thinking about a dual degree program was the application of business concepts, things that I'd seen at my investment bank, and applying it to healthcare delivery. There's a lot of different components to healthcare delivery that I didn't even know were important until kind of going to talk and getting exposure in the hospital here. I really thought to be an effective healthcare provider or be part of a system that provides healthcare that I simply needed to study and memorize the right drugs, the diagnoses, the treatments, and to stay updated on the evidence. And that would make me a great doctor and make sure that my patients were getting the best care. But as I kind of went through the process of my medical training, I realized that there's a lot more to the healthcare system than just that physician-patient relationship or the specific treatment. It's part of a much longer, more complicated process of care or value there. Medicine's very complex, lots of details, and there aren't really that many tools for physicians or systems to ensure that patients really do get the best care they can. An MBA is so much about implementation and execution that it seemed like that was a real space for kind of the application of my skills. So I think that's kind of a big piece that's missing right now. Because there's countless statistics about we have the evidence, we have the device or the pharmaceuticals, but the patients aren't getting them. I believe there's kind of a need for leadership in terms of how we see or how we envision healthcare going forward. And that can happen at a clinic level, hospital level, or system level, or wider. But I'm extremely excited to kind of be a part of that. There's tremendous impact in working with one patient and changing one patient's life or their health. But for me, I was thinking about how many patients I could impact on a wider scale. And you can think about that in kind of one surgical center, or maybe you have a network. And I'm hoping that my role kind of expands in that way. Certainly I need to learn how to take care of one patient, but I think that's where the MBA comes in, is thinking beyond this one patient. How do I impact or improve the care that we serve to the larger populations that share so much in common? I am going to complete residency in anesthesiology, and I'm going to Johns Hopkins for my training. One of the things that attracted me to anesthesia was we play a role in a variety of procedures, and we work with a lot of different specialties. And that was important to me, to be kind of at the center where you could kind of potentially influence a lot of different components of healthcare delivery, particularly kind of in the perioperative period. So it just seemed like an exciting and appropriate place for me to be as I look to kind of hopefully be an agent of change going forward.